Prescription digital therapeutics, or DTX, are going to change the tools that US-based physicians and their patients use. DTX manufacturers and providers are working to adapt healthcare reimbursement systems to recognize these innovative interventions. One of the first questions they will face, however, is what codes can be used to report digital therapeutics on healthcare claims. I'm Monique Nolan, counsel with Arnold & Porter.
I'm Amanda Cassidy, Senior Health Policy Advisor at Arnold & Porter.
In this video, we will discuss what you need to know about the Healthcare Common Procedure Coding System, HCPCS code sets, including what it means to have a HCPCS code, when a digital therapeutics manufacturer might want to seek a new code, and how that process works. Amanda, to begin, what is a code?
A code is really just a way of conveying information. It's a means for a healthcare provider, practitioner, supplier to identify the item, the service that they furnish to a patient, or other critical information about the patient, such as the patient's diagnosis or their clinical condition, and send that information to the payer. Then the healthcare payer takes the information and they use that to implement their coverage and their payment determinations. So again, since it's just a means of conveying information, it's important to remember the code itself doesn't really tell you anything about whether or not an individual payer will actually cover a code or pay for the item or service that's described by the code. And there are a lot of different code sets that are used in the healthcare system. There are codes for diagnosis codes, for inpatient procedures, for outpatient procedures, and for items and services that are related to healthcare services. And that's the code set we're going to focus on today, the HCPCS code set. Can you tell us a little bit more about the HCPCS code set?
Sure. HCPCS is really a national standardized medical code set recognized by HIPAA. And there are actually two levels. Level 2 is really what's relevant today, but for context, HCPCS Level 1 codes are developed by the American Medical Association. And those are codes that describe the services of physicians and other practitioners, called CPT, or current procedural terminology codes. The Level 2 HCPCS code set describes items like drugs and biologicals and other types of non-drug and biological items and services, such as supplies, equipment, things that are not described by the CPT Level 1 code set. And they're quite often referred to as alphanumeric codes because the first digit is a letter and then it's followed by 4 numeric digits. And some examples are J codes that describe drugs and biologicals. There are also K and E codes, for example, that describe durable medical equipment, which is used in the patient's home. And CMS, by and large, maintains the Level 2 HCPCS code set. They make the decisions about whether to create a new code, revise an existing code, or remove a code. But what's important to keep in mind is that while CMS makes a lot of these coding decisions that are relevant to the Medicare program, which obviously they oversee, this code set is actually available for all payers and applies to both public and private healthcare payment systems. And so CMS does have to take into account the needs of other payers when developing these codes. So Amanda, having described the HCPCS code set, does every item or service have to have a HCPCS code?
No, and every item and service won't get its own code. There are a couple of different reasons for that. Some devices are not eligible for HCPCS codes. A device that's used as part of a physician service won't get its own code. For example, a scalpel that's part of a surgical service, the code that describes the surgical service will report all the components that are needed for that service, and the individual devices or equipment that's used as part of that service likely will not have its own HCPCS code. And then the other reason, even if the device might be eligible to receive its own code, there may already be an existing code that describes the new device, and that it could be beneficial to a manufacturer. If there's already a code available, then as soon as a device is approved by FDA, physicians can start reporting the device on their claims using the existing code. However, if there's a clinically meaningful difference between a new technology and an older technology, it may be appropriate to seek a new code. That could be because a new device is used for a different patient population and there may need to be a change in the coverage policy. Or it could be because there's additional costs associated with a new device that a payer may want to recognize and set a different payment rate. Those are all reasons why manufacturers may want to seek a new code. But on the other side of the spectrum, payers don't necessarily want to have individual codes for every individual product.
That's right. And CMS in particular has said repeatedly that it doesn't want to explode the code set, that it wants to maintain efficiencies and reduce burden with respect to claims processing. And so that all factors into sort of these competing interests with the various goals of the providers and the payers. But sort of speaking of CMS's decision making, the HCPCS process varies depending on the type of item or service. Drugs and biological applications are on a quarterly basis, but for items like DTX, potentially non-drug, non-biological HCPCS applications are no less than biannually addressed by CMS. So there are essentially two opportunities during the year to submit an application, which are available online, and they're fairly straightforward. They are designed in a way for CMS to obtain information about the underlying item, the setting of use, who it is furnished to and by whom, and other information like FDA authorization, which is actually a requirement in order to submit an application before CMS will consider it. And then CMS will review the materials and issue a preliminary decision and recommendation in response to that request. And then there's actually an opportunity to have a public forum where interested parties can weigh in, submit questions about the application. The applicants have an opportunity to provide a presentation to the agency and anybody who wants to attend the meetings. And then CMS also will ask questions. And all of this is designed to inform its decision around the coding request. And then after that, CMS will subsequently issue a final decision about the coding request, where it may grant or reject what the applicant has requested.
So I think it is important for manufacturers to know that the process that you just described will take from the time an application is submitted until a new code is effective at least 9 months. And then when you factor in the time from when the product is approved, since that's a necessary element, and then preparing the application, it's probably closer to a year from the time a product is approved to the first point at which a code could become available. But it's also not unusual for CMS to defer an application to a future coding cycle if they have questions about an application or how something might be used. Or it might be necessary for a manufacturer to request a code in multiple cycles if CMS hasn't identified a need for themselves or another payer to have a code that describes that technology.
That's right. And so really manufacturers should start thinking about coding early in the process when they're actually on the FDA regulatory side so that they can anticipate this timeline. But, I think it's also important to note that in the absence of a specific code, there is an ability to submit a claim and describe a service using a non-specific or sometimes referred to miscellaneous code.
Right.
So Amanda, assuming CMS decides to grant a new HCPCS code, what's its significance?
Now you have a way for payers to identify your product. It probably won't be specific. It won't include the name of an individual technology, but it will describe a new product. However, as we said, that doesn't mean that there will necessarily be coverage or payment associated with that new code.
And that's particularly true for Medicare. For CMS, they have statutory requirements with respect to benefit categories and for coverage reasonable and necessary standards. So the fact that there may be a HCPCS code that describes a particular item, it does not mean that it would necessarily be covered under Medicare.
And that first element is one that has been an issue, is an issue for DTX. CMS has determined that there is no benefit category, which means there's no statutory language that allows for coverage of DTX. For other items and services, when CMS is identifying and considering the benefit category determination, they've now started to include that information as part of the public meeting preliminary determinations. They're also providing information about how they might be considering setting payment rates for new codes that they're considering creating. So the issue of benefit category and payment determination is something that can be discussed in the public meeting, that stakeholders and applicants can respond to what CMS is suggesting. But for DTX, the benefit category determination has been and will continue to be an ongoing issue. What other kinds of trends and things are we seeing related to the HCPCS coding decisions?
So lately, there's been quite a few requests for codes that pertain to devices that collect information in the home. However, CMS has been fairly consistent in its response to those requests, really indicating that if the information that's acquired is really furthering the service of the physician and the medical decisions, that it's not appropriate for a HCPCS Level 2 code and instead really should be incorporated and covered with respect to the service that's described by the CPT codes that I mentioned in the beginning that are Level 2 and describe physician and other practitioner services. But there's been a lot more activity with those types of requests of late.
And even though, as we say, there's a benefit category issue specifically for DTX, I think it's important to also point out that CMS is staying engaged in these issues. There was a summit earlier in June where a lot of important components from HHS that would touch on DTX issues, including FDA, NIH, the Office of the National Coordinator for Health Information Technology, they were all present, including CMS. CMS did note the challenge related to the benefit category, but also indicated that they're tracking legislation that might change that in the future. So I think that's something for all of us to stay tuned to, and it's good to know that CMS is staying tuned as well.
Well, we hope this session has been helpful and you've learned more about HCPCS codes and their relevance to DTX. Thank you for joining us.